everyone. How are you? I want to give the camera guy something to do, you know, so move around, as many of you know in New York. How many New Yorkers? All right, we got a lot. Look at the hands go up, the hands go up. Well, ladies and gentlemen, New York is in the house, as I said. We're here for very, very good reason. As you know, in New York, it's been a little challenging over the last 15 months. I came in with a mandate from Elliot Spitzer to say, just do it. And now, luckily, happily, proudly, I was reappointed last week under Governor David Patterson. He says, get it done. So, what has happened over these last, certainly these 15 months, and again, remind you that I am one of only 2 cabinet-level positions in the country for substance abuse, alcohol and substance abuse. That is another area that needs to change. So when I come, I report directly to the governor, and we know that that's important to keep the governor online. Our job description is very clear. What has kept us going for these several last 15 months, and certainly most recently in the last 2, is that we have stayed on mission. Our mission is very clear: to improve the lives of New Yorkers by leading a premier system of prevention, treatment, recovery. And we've said through the last several weeks, when we have all been traumatized, you know, in New York, in addition to the work we do every day, is that we have to stay on track. And our mission was the same yesterday, as it is today, as it will be tomorrow. So as we push, we go back to the basics, and the New Yorkers in this room have heard me say this 100 times. Prevention, treatment, recovery. Prevention, we spend about $80 million in New York, a lot of money. Are we doing right by it? You know, we know last month that 50% of the kids in grades 7 through 12 had a drink in New York. You know, fact. What are we doing about it? Is the prevention dollars going for the outcomes that we need? Treatment, 110,000 people every day we serve in New York. 110,000 people every day. We are working to make sure that that is a gold standard of treatment. Gold standard of treatment, that we know what the outcomes are, and I can guarantee you the outcomes are ongoing long-term recovery. Are we there yet? No. But we are doing everything we can to be there. We look at the facts in New York. We also know, as many of you do, we looked at wellness. What do we know about wellness? We know that in New York, less than 18% of New Yorkers smoke. But we also know that 93% of New Yorkers with an addiction smoke. What are we going to do about it? We will, on July 24th, be the first in the nation to have a tobacco-free alcohol and substance abuse treatment system. A prevention, treatment, recovery system. That is no easy feat. I've got a lot of bruises, you know, as a result. But what we do, you know, what we did is we looked at the facts, and the facts were clear, and both governors said, get it done. Do what is right, move forward, get it done. That's what we need to do. If we truly care about recovery and people's health and well-being and wellness, which is what we talked about all over yesterday, then we have to address this other addiction that we know is the killer. A killer. Sometimes the killer. So, not popular, the right thing to do. So, if we look at that gold standard, how can we make sure that we have the models and that we're reviewing it so we know what can be done? Are you leading a better, is Phoenix House doing better than Odyssey House? You know what? A report card, just as they do in healthcare. Nothing wrong with it. You're not going to send your daughter to have her tonsils out. You're not going to send your son to have heart surgery. You're not going to have your wife go to a cancer care doctor when he's done it once. Right? When he can't show the outcomes, that's okay. Bring it on to our field. We need to start showing those outcomes and look at who's got better retention rates. Right? Who is doing the 90-day follow-up? Who is doing the 6-month follow-up? Who is doing the 1-year and the 5-year? And make sure in our state and in this country, we look to reform and reinvest. That's exactly where today we know we have 2.5 million New Yorkers with an addiction. 2.5 million. We also know, just in my system of oversight, we spend $1.7 billion. Another thing that I'm not so popular on when I say we have the money. We have the money. But it's not in the right places. This is old. We know we have the money. We know today in detox we're spending $1,400 in a hospital-based system. Right? We also know that 50% of those individuals could be served in the community. So what are we doing? We're moving it out into the community. How do you pay for recovery-oriented systems of care? You use that money to look at the outcomes. To have the recovery recovery centers to look at the groups, to see where somebody is 6 months after treatment. Do they need to come back in quickly and go back out? That's what you do. Methadone, we've had several conversations. We've got a lot of methadone stalkers with me today because we've been with them all week. And this is what we're doing. We're transforming the methadone system so it's no longer a standalone. It's not going in this door and on methadone. We're incorporating medication-assisted treatment into our entire system. That's how we will transform it. When you come to the ATOD conference, Mark and I are here in New York, we will tell you all about it. Because we are working very hard to have that transformation. We are the largest methadone provider treatment system in the country, if not the world. So we are leading, because that's our mission and that's our charge. We're trying to lead, and we're arrogant New Yorkers. You all know that. And so, we need to lead. So we take that on and we say, what are we going to do to begin to transform the system? And it is going to be eliminate methadone as a standalone. It is going to be part of that door that I walk into. Do I need methadone? Do I need buprenorphine? Do I need one-on-one? Do I need just to go to AA? Do I need to do this? You tell me. Person-centered, family-centered treatment approach. Not just the door I walk in. So watch, because we're working very, very hard on that. We're spending a lot of time in those transformation elements because we know we need to move out the money in the area, which is, and you can hold me to it, the #1 priority in New York. Recovery is a business line in the state of New York. It should be prevention, treatment, recovery. In our mission statement, the English majors can't stand that we don't have prevention, treatment, and recovery. And we did it purposely because it's not and. It is not an and. I've got a younger sister. I've got 4 sisters, Karen, Chris, Colleen, and Connie. For half of her life, she thought she was adopted because we said and Connie. And that has stuck with me for the purpose because it's not an add-on, right? Recovery is a fundamental business line of what we do. That's the outcomes, it's the research, it's all the conversations we've been having. Recovery is prevention. It goes all around, we know that. So our focus and element is on recovery. But what does that mean? And that's why we're here. And that's why I'll tell you some of the things that we've been, and I never looked at my notes after I read them, but tell you some of the things that we're looking at. We, in some of the articles, and said, and Samson, all the folks said, how are we doing in New York? And I said, you know what, we're following what you said we should do. I'd like the money to come along with it, because 15 years ago, when I was with Governor Cuomo and we did the merger of alcohol and substance abuse, we were getting 17% of the federal dollar. We're getting 7%. All right? Why did they say that? You haven't had leadership in New York. Guess what? New day. All right? And so we're doing what we said we needed to do. We have a recovery bureau. Lorraine, stand up so everybody can see who we are. She leads our recovery bureau in New York. She's got ribbons on, a bunch of folks with her, because we said it is a business line for us. That's okay for us to talk in human services about business lines, because that means that gets attention. Prevention, treatment, recovery. There's not anybody in our agency or in our state that don't say those 3 words. And we go back to, what are we doing? Why are we doing it? Prevention, treatment, recovery. So some of the things we've done in addition to reporting the Bureau and making it a business line is we had last year recovery forums. And we, like any New Yorker, we went to Connecticut and we went to Vermont, and last night Philadelphia. We will steal anything we can to promote the system that we need to. So we held recovery forums, and we did it in partnership with the field. We brought people together and we talked about and learned, what we needed to do to go forward. We also spent a great deal of time coming back and having recovery implementation. 70 people every month, every 2 months meet. And then, is it what quarterly? All right, well, okay. It may have to be more. But every month there's a meeting of over 70 people, in different parts and subcommittees, and then come together quarterly that talk, and is chaired by Lorene at Oasis and Keith Stack, who's here, wave Keith, who was part of the field community, because every task force we have, methadone, detox, anything that we're doing in the state of New York is chaired by an individual in the state agency and someone in the field. Every single one. Because that partnership is the only way I know to move forward. And clearly we're spending time now as we go forward on that implementation. We're talking, we have the recovery walks, and yes, we have the recovery festivals, but here's what I know, And this is where I think we're transcending, and I hope we are in not only our state, but in other places. We are talking about recovery as a badge of honor. My words, where we've begun. But then when you start to hear your words other places, you know we're making a difference. Not because they're my words. I most recently come from the American Cancer Society. And many of you know many years ago, we whispered, right? You whispered. In recovery, only said that in recovery, technically, for 35 years. Called himself a teetotaler until about 2 years ago. You know, because that's all he could come up with. Look, this position of being in New York, I'm in New York Times, I'm in the newspapers, and I get the letters from the CEOs, from the teachers, from the janitors. Pretty soon, Karen, we'll be with you. Pretty soon. Just can't do it yet. So I know, again, my job and the job of this state agency and this governor is very clear. Create the environment so people can wear their recovery as a badge of honor. I also am I've been in rooms where they've said to me, 3 minutes, you're telling me? A minute now, okay. In rooms where they've told me the idea that we're running afoul to the Alcoholics Anonymous Fellowship. And I said, what do you mean? Well, you're promoting people tell their story, we can't. Absolutely not true. So where do we go? We go to the AA Fellowship in Manhattan, the national, the international organization. We ask the question, can we do this in parallel? Absolutely. Absolutely. So now we have the answer. And as we continue on, this year we will have a major September 14th, 15th, right? September 14th, a recovery conference in New York, you know, to bring New Yorkers together. So we have New Yorkers for recovery. So I want every New Yorker in this room to go to Bill White and tell him one day, just one day, we just need one day. I told you, Bill, one day, you know what I mean? Well, you'll be very tired at the end of the day, but it will be well worth the effort for all of us to begin to promote what we need to do going forward. We also will initiate a stories campaign, very similar to the 52 that was done many years ago. We are going to start and respect the 12 steps and have 12 people on a rotating basis every year, 12 plus the thousands, right, that we're going to have on the stories, but we're going to highlight 12 people. The governor's going to announce it where they see the faces and voices and New Yorkers for recovery. So, I want to thank you for helping us be part of this. We are working very hard. We are looking to you for the opportunity, but never forget, the New Yorkers are in the house, and I guarantee you, if you help us, we will do everything possible to take this recovery movement exactly where it needs to go, because we, together, have that power to make a difference. Thank you very much.